Andrew McKeever talks by phone with Dr. Anje Van Berckelaer of the Battenkill Valley Health Center about the coronavirus.
I'm assuming we haven't heard any cases yet, any positive cases in the Arlington area where you're serving.
So in our immediate area, there are certainly people who have symptoms that are consistent with coronavirus, and there are enough cases statewide and in the surrounding states that I assume that some of those would test positive for corona if we were able to test them. Right now, we're not testing lower risk people because the number of tests is very limited.
What's your biggest concern right now in terms of the ability of the medical community to deliver services? Is it around the relative scarcity of the testing kits, or is it something else?
I think I have many concerns, and it's hard to prioritize them. One is the health of the caregivers, so the doctors, nurses, respiratory technicians, both in the outpatient setting and in the inpatient setting. Because personal protective equipment is hard to come by, everyone's doing their best, and the state is trying to reallocate or obtain resources for clinicians who don't have gear, but that's a work in progress, and so we are insufficiently protected as providers, and when the workforce is sick, then patients don't get as much care. So that's one concern. Another concern is the lateness of testing, and that's been talked about a lot in the news. People are ramping up, commercial laboratories are ramping up. I expect that the quantity and availability of testing will start to rise in the coming weeks, but in the meantime, it's limited to people who are quite ill or healthcare workers who need to be able to return to work if they test negative. And then in the larger scheme, I think another serious concern is if it continues to spread as quickly as it has been, we will exceed capacity of our ICU beds pretty quickly. And that's not something as a primary care doctor that I'm involved in, but obviously I follow it because those are beds that my patients might need. The hospital has been extremely proactive about planning for this, and I've been very impressed with how they've really pulled together and are planning ahead. But if there are only so many ventilators and so many hospital beds in the nation, everyone is going to be short, at least a little, if not a lot.
So in the meantime, I guess, would your recommendations for folks be pretty much along the lines of what we've been hearing? Wash your hands a lot, don't touch your face, and kind of be mindful of surfaces that may have been touched or whatever. Is that the best course of action folks can take to minimize their risk of getting the disease?
People who don't currently have any symptoms, absolutely. Wash your hands, stay away from crowds, self-isolate. If you can work from home, work from home. Many people, unfortunately, haven't been given the option in the sense that they work in an industry, for example, in the hotel and restaurant industry. Some people have simply been laid off, and that is, I think, some of the non-medical side of this is that people in communities are going to be struggling whether or not they get coronavirus for financial reasons. And so I think it's really important to look out for your neighbor, both if they get sick and if they're going hungry.